I am with Joanne Jones this morning. She is the president of RDH Connection, and she is the speaker at RDH Under One Roof in Las Vegas this summer. So we're very excited about having her at RDH Under One Roof, and thank you, Joanne, for taking a few minutes to talk with us this morning. The I want to start off by asking you to give us a brief course description, if you will. In doing so, can you include why you think it's so important for dental hygienists to be actively involved in the identification and diagnosis of oropharyngeal cancer?
Absolutely, and thank you, Mark, for having me here. I just am bubbling with enthusiasm for Vegas this summer. What a fabulous venue, and on top of that, what a fabulous conference for our colleagues. Just thrilled to participate. So my course basically is an overview of what's happening in today's world with oral cancer. It has caught us totally unaware and totally by storm. When you look at the American population, or I should say the North American population, 50 to 75% of sexually active adults will have an HPV infection in their lifetime. So when we look at this escalation in HPV-related oral cancer and oral pharyngeal cancer, it's no real big surprise. The problem is, though, what we have customarily looked for in the past is no longer what we need to look at in the present. We do need to obviously, keep in mind that smoking and alcohol are precursors of oral cancer, and that's so important to be aware of that. But this new profile, totally different symptoms, totally different recognition, different anatomical landmarks that are high risk. And why is it so important for dental hygienists? Because it's our profession, it's us. We are on the front lines of discovery. Otherwise, if it's not us, it becomes the forgotten disease that the human race is having to deal with.
Well, I think the dental hygienists who attend the course will appreciate that. The course is designed to be interactive, in that, if I understand it correctly, you're going to be asking participants to review some cases, I guess, that you're familiar with. How would you describe the interactive part of the course?
Well, the interactive component is designed for a couple of reasons. I think with knowledge translation, it's so important to be engaged. It's so important to participate. If you simply kind of sit there and take notes, it's difficult to often internalize exactly what to take back to practice. So what I've done, being we're all visual learners, is I've put together a gallery of HPV lesions so that our colleagues can see, the different types of HPV lesions, what they look like, where they occur, and how to document them. That sometimes is a big thing that holds us back. How do we remember all those words we learned in school, like pedunculated and sessile and things that we don't use every day? So I've got some really good clinical resources to give out as well. But the other thing is cases. Absolutely. It's so important to be able to kind of do a breakout and do some critical thinking. Take that knowledge and apply it while we're sitting there. And then the last part of the interactive component, which is really my favorite, is the anatomical landmarking, where I'm actually going to walk attendees through palpating in different ways, different things that are even in curriculum as we speak. And these are things, Mark, that I've learned through my own personal journey with a family member, and I will share that poignant story. But these were opportunities that I had with top oncologists to be able to learn, what does a malignant node really feel like, and how do we really palpate to get the best out of our extraoral and intraoral examination. So as you can probably gather, I'm totally charged up to share this information, because you know what happens? This is so cool. Every time I go to a conference, or sometimes, you know, it happens, I open up my email in the morning, somebody says, I found something. That's an incredible feeling to think that, you know, maybe, not to be over dramatic, but maybe that little tidbit of knowledge helps save a life, or it may have improved the quality of life for an individual because the discovery was made earlier. So all in all, you know, I just feel it's a huge privilege and an honor to be able to share this information.
Well, I can see how this can be a very inspiring course for dental hygienists at RDH Under One Roof. Um, you were talking about how attendees will interact with you before a presentation.
Mm-hmm.
You encounter someone before this seminar, and they ask me, "What do you think I will go home with after the conference?" What are your hopes? I know there's some practical applications that you think they'll be able to take home with them.
Well, that's a great question, and I can answer that very confidently in trying to convey major principal points. I don't want anybody to feel overwhelmed or to feel they have to do a 10 or 15-minute examination. We don't have that luxury in our dental hygiene treatment room of having extra time. So what I'm going to do, my purpose, my objective, is to really zoom in on critical areas, zoom in on high-risk areas, and allow dental hygienists to be able to incorporate that with ease into their practice. I also have some wonderful tools. I've got a list of probably about 15 different resources, many of them of which are available online and are free to our profession. Because as you can imagine, this is a little bit of a tricky subject to be able to bring up to our dental hygiene patient. So I want our colleagues to be equipped to be able to integrate that knowledge and to have complete knowledge translation. And the other thing that I'm super excited about, I have wonderful sponsors that I work with that don't expect me to deliver a product-based lecture. They just want the information out there about early screening. So I've got a sponsor that has a wonderful online program that they are sharing a temporary access with all attendees. But the really exciting thing, and I know, Mark, you're going to say there is no free lunch. And you are correct, my friend. However, there is an opportunity for all attendees to be able to have delivered to their practice within the following week or a couple of weeks after RDH Under One Roof, a screening device with a retail value of close to $3,000. And the only commitment on our colleagues' part is that they simply employ opportunistic screening a minimum of 3 times a day. I think that's an incredible offer, and I'm really, really excited to share that.
Well, that does sound exciting. Again, the course presented by Joanne is called Sex and Oral Health, What's the Connection? It is scheduled for 8 a.m. on July 15th at RDH Under One Roof, which is at Caesar's Palace in Las Vegas. Joanne, thank you for talking with us this morning.
Thank you. Hope to see everyone there. Thank you, Mark.
We'll see you there too. Thank you.
Great. Thank you.